Welcome, everyone. I'm Missy Forey. I'm the Human Resource Director with Northern Tier Counseling. I just want to go over some items about Northern Tier Counseling, the services that we provide, as well as then the various positions or career opportunities that we have in the human, specifically for the human services field. So our mission statement is to welcome and serve all those seeking wellness, renewal, and hope at Northern Tier Counseling. So really, we just want to make sure that we're providing the best care to our clients in the various programs that we offer. So just wanted to show a little bit about our org chart. Our CEO is Paul Denault. We do have, there are 4 directors then. There's 1 clinical director that oversees all of our children's programs. We also have a director then of recovery services, and I'll tell more about those services as we go forward. We also have an outpatient program manager who oversees our outpatient program as well as our drug and alcohol services. So we have a couple of locations. Our main location is located in North Towanda. We have several services out of that particular location. So that's our main corporate headquarters, so to speak, but our outpatient therapy is there. Our drug and alcohol treatment services are there, as well as our recovery services are now there. We recently had our wellness program here in actual Towanda, and we moved those recently to our North Towanda building. So it's a new and improved facility that we have for that particular program. We also then have a Mansfield location, which primarily does outpatient services. And we also have a location in Sayre, which again is primarily outpatient therapy services. We do offer open access clinics. So what does that mean? It usually means that we can get into treatment a little bit quicker. So if you're scheduling, you haven't seen a therapist yet, and you're scheduling an appointment for the first time, that's when you can go into one of our open access clinics. So we have those at North Towanda. We also have those in our Mansfield and Sayre offices. So here are the various times where we have those open access clinics. So if you call for an intake appointment, that's when we'll get you into one of those clinics. And then from there, you'll see a therapist on a regular basis. So just a little bit about our outpatient and drug and alcohol treatment facility that we have. So we're a fully licensed outpatient and drug and alcohol. So we have a couple different licenses, but our outpatient therapy, that's where we have master's level and or licensed clinicians that work in our outpatient therapy. We also have drug and alcohol services. So we provide all different types of services, not just for individuals, but also for couples, for families. So we can seek marriage counseling, bereavement counseling, any type of counseling services that somebody might need. We do accept pretty much any of the major insurance plans. So definitely Highmark, also Medicare and Medicaid. And we also have full pay. We also do work with financial aid and full pay arrangements as well, in case somebody doesn't have insurance. Substance use counseling, again, it's fully licensed by the Department of Drug and Alcohol Programs. So in this particular program, again, it's kind of the same, but it's specifically for individuals that are struggling with drug and alcohol. So again, individuals, couples, marriage or family therapy. So any type of counseling services specifically related if you have a drug or alcohol program. Again, same thing. We accept Medicare and Medicaid into this program as well. Adolescents, underage drinking and substance abuse. So if there's a teen or an adolescent, we'll do treatment for those as well. It's not just geared towards adults. We also offer intensive outpatient counseling. So this is specifically for drug and alcohol. It's a 3 hours, 3 times a week that you're meeting as a group to do this particular type of counseling. So it's 9 hours a week. So it's a pretty intense program, again, specifically geared for drug and alcohol problems. Psychiatric care and consultation is also available and part of all of the programs that we offer. Outpatient school services. So we have a lot of different programs also based in the local schools. So our school-based outpatient and privately contracted social workers. So we have social workers that are in the Canton School District. We have Troy. Troy is not an outpatient site, but we do have an outpatient site at Towanda is licensed, Sayre High School, Athens, Northeast Bradford. All of those are licensed sites where we can actually provide an outpatient therapist that can go into the school to provide counseling to the kiddos. So they don't necessarily need to come to our outpatient facility. So just try to make it easier access. We also offer outpatient psychiatric services. So we have 2 psychiatrists that are on site. We also have 2 psychiatric certified registered nurses. There's one in our Sayre office, and we have one in our Towanda office, and she also goes to Mansfield a couple times a month. And then we also have two psychiatrists that provide services. So again, we try to make sure that our psychiatric services are also widely available as well for the medication management program that we have. You do need to see, in order to seek psychiatric services, if you've never been on medication management and you don't have a referral into the program, the first step is to see a therapist. We want to make sure that you're getting evaluated, you're seeing an outpatient therapist first, and then we can transfer you into to get a psychiatric evaluation. Community and school-based behavioral health services. It's quite the tongue twister there, but we have 4 different teams. We have a team in Towanda, a team in Athens, a team in Northeast Bradford, and a team in Troy. Troy was the other one that I missed. Usually the team consists of 1 master's level clinician and 2 bachelor's level clinicians that are in the schools working with the kids. So in our Towanda school district, we have a couple teams. So we're able to serve the ages of kindergarten through 6th grade. In Towanda, in Troy, it's K through 2nd grade. In Athens, it's K through 5. And in Northeast Bradford, it's K through 6. This is a 12-month program. So it's not just while the kids are in school. It actually goes through the summer. So in the summer, they may or may not meet in the school. They can also meet out in the park. We can, rent like a church. We can meet, somewhere else within the community. But we're providing kind of treatment again for the kids that might be struggling with behavioral issues within the classroom. So meeting them in the classroom, trying to help kind of resolve those, work with them on coping skills. And then in the summertime, kind of the same thing, just working with them throughout the summer and their families as well. So that's where the master's level individual will go out into the families. That's why we're calling it community and school-based. So we're not just meeting them at the school, but we're also meeting with their families to kind of go over some skills that can help the child with behavioral issues. We also have an adolescent partial program. This is geared for grades 7 through 12. It's at the Towanda School District, but they can actually come from other school districts. So they can come from anywhere in Bradford and Sullivan County schools can actually transport them to Towanda. So that's how they would, any school can kind of refer them into that program. So again, this is, in order to be in the program, they would need to get a psychiatric evaluation just to determine the need from an insurance perspective to see if they are a good fit for the program. But basically, while they're at school for the day, there's a teacher that's part of the program. So they're still getting their schooling and their education, but it's more directly in a different kind of setting than what their normal, classroom setting would be. And then they also have groups during the day as well. Again, just to kind of help them with the behavioral issues that they're experiencing. We also offer family-based services. So this is a really intense type of treatment that we provide with families. We actually have 8 teams. Each team is made up of 1 master's level and 1 bachelor's level that go into the homes to work with the child as well as the family. So it's not just geared towards the child as the main patient, so to speak, but it's really working as the family unit. So it's very intense. It's usually a 32-week program, and they're usually meeting 3 times a week. So it's again, just making sure that the whole family is working together on addressing the child's behaviors. We also have intensive behavioral health services. So this is similar to community and school-based. Sometimes people when you think of like mobile therapists, that's part of the IBHS services that we provide is mobile therapy. Again, a mobile therapist going into the home to meet with the child, or they might also be meeting them at the school, just based on the type of need and psychiatric evaluation they have. Depends on the type of program that they might be a best fit for. We also have a psychiatric rehabilitation program or a wellness center. So this is geared towards adults 18 and older. There's 5 domains that we really work on with the individuals that are in this day program. So it's living, social, educational, vocational, health, and wellness. So again, those are the goals that they're setting while they're in the day treatment. They can be flexible as far as they don't have to attend a session every single day. So the schedule can be flexible to meet their needs. It's all individualized. Again, they're setting their goals individually in a group setting. We also have a wellness cafe that's on site where the residents of the program or the clients of the program can actually learn life skills. So they can learn how to cook and how to serve, and also, just even the cashier, so everything that would be involved as serving in a restaurant is also involved with the wellness cafe. So it's really kind of geared, the wellness cafe is really geared towards like the transitional living, transitional age youth. Some of those that are coming out of high school, they might not have quite the experience and they might need a little bit of help. This would be a great program for them. Peer support services is really one-on-one supportive services. So there's actually a certified peer specialist that would meet with a consumer, again, to kind of go through life skills. You're still working on those 5 domains, but you're doing it out in a community setting or out in your home setting. So the peer support specialist is going into your home to meet with you, again, setting your goals. So the consumer, the client is really the one driving what that session might look like. So that when the certified peer specialist comes to meet with you, they're asking, what do you want to work on today? And you're the one really driving that session. So somebody might be afraid to go out in public or go to the grocery store, especially right now with everything going on, that might be a common thing. So let's work on that today. Let's go to the grocery store. Let's see how we can, help you work through those coping skills. We also have a decision support center, which is really geared with our medication management. So those that have medication management, the decision support center will go through a series of questions. How well are you doing on your medications? Are you sleeping? Are you anxious? Really going through a set of questions, standard questions that can then be used when they see the psychiatrist. So the psychiatrist already kind of has a heads up on what they might need to work on. The decision support center will also give resources. So if they're struggling with just wanting to learn about something that they're struggling with, they might have books that they can give them as a resource or as a tool. So it's just another great program that's tied with medication management. Just listed here how you can access the services in Northern Tier Counseling. It's really by contacting our main number, asking if you're interested in seeking an appointment, and we go through the intake process. We want to talk about the different careers now that you learned about the various programs that we have, because we have like 7 or 8 different programs. So all of those programs have different jobs, obviously, tied to them, and all of them are through the human services field. So there's a wide range of jobs that we offer. So I kind of broke it down first by degrees. So what's a master's degree? Like, what are some of the positions that would require a master's degree? And here they all are. There's quite a few. I started with the clinical director. Then we have a recovery services director, our outpatient program manager, our outpatient mental health therapist. So those that work specifically in the clinic. Then we have our family-based mental health therapist. We also have our community and school-based behavioral health professionals. And then we have our children and adolescent partial hospitalization program supervisor. So I'm just going to highlight some of those positions that would be like the mental health therapist position. What's required, or what does that position actually do? So you have a case, basically you're working in the outpatient facility at any of our locations, and you're responsible for your caseload of clients. That caseload can vary. If you're a full-time employee, a caseload could look around 80 clients that you're seeing. Some of those you might be seeing weekly. Some of those you might be seeing once a month. Some people just want to come in. They've been seeing a therapist for a while, so they're pretty stable. They just want to come in and they have their monthly session. Some people might need more intense treatment. So you're kind of working through, what does that look like? It's all individualized treatment though, setting a treatment plan for each individual that you're seeing. So again, the mental health therapist could be in the clinic, but they could actually be in the school. Because if you remember previously, I had that list of schools that we can actually send a counselor to. So Athens or Northeast. Those are the various, again, positions that we offer. Experience in mental health and substance abuse is definitely helpful, especially working in the clinic. When you have that caseload, it's definitely helpful to have that some type of experience going into that. And we'll talk about what the family-based position is a really good way to gain that type of experience to be a mental health outpatient clinician, or if you've had a practicum going into the field, that's also helps. So the family-based mental health professional, you actually do not need experience to be in this role, just need a master's degree. It can be a master's degree in human services, actually education as well is one of the master's degrees. It's allowed for this particular program. But this is a program that I talked about as a really intense type of program where you're going into the home and meeting with the family. So the child is the main client, but you're meeting with the family as a whole to help overcome their behaviors. What behavior modifications can we use? through that. So again, really intense treatment. You get to know that family because you're meeting with them 2 or 3 times a week. So you're really going to get to know that family in that 8 months that you're with them. So again, that you can gain a lot of experience, and it's you and a bachelor's level individual that you're working with. So you're really helping to provide coaching to that other individual that you're working with. You're both doing the case though. You're both providing the therapy. You're both doing the case notes. But again, as the professional, as the master's level professional, you're helping to provide coaching to that bachelor's level. So again, it's a really great way to get experience in the field. Community and school-based behavioral health professionals. Again, this is the one that you're in the school working with the kids while they're in the school during the day. And then in the summer, you're also working with them as well. It's out in the community as well as the school. So you might be going into their homes in the evenings to work with them and their families. So not necessarily just working with them during the day. You, as the professional, as the master's level, in this case, you might have 1 or 2 bachelor's levels underneath you. So you're the one really managing the case and working with the other 2, kind of directing the services that that the 2 bachelor's level are going to provide. Then we have our children and adolescent partial hospitalization program working supervisor. So this is the individual that's working in a classroom setting with the ages, grades between 7 through 12. So can be a diverse group. You know, you can have 12-year-olds mixed with 18-year-olds that you're providing counseling to or groups to throughout the day. You're running that program. So in this position, you're determining what does each day look like? What does the curriculum look like for the day as far as what it's going to be based, again, it's individualized treatment, but based on what the group is experiencing. So how do we provide care for all of those students? And working with the teacher, and then you also have a teacher's aide and a bachelor's level individual that's underneath you as well. So really helping to direct all 3 of those individuals in the program. So bachelor's degrees, lots of options with a bachelor's degree as well. One of them is a drug and alcohol counselor. We also have our family-based mental health worker. We also have our community and school-based behavioral health services worker or technician. And then we have a mental health worker for the child and adolescent partial hospitalization program. So those are all the ones that require a bachelor's degree. Drug and alcohol counselor. So again, professional, you're providing professional counseling services specifically related to drug and alcohol. So if they have a mental health or co-occurring diagnosis, they're pretty much going to be meeting with a mental health therapist. So this is really specifically if their main struggle is with drugs or alcohol, is where the drug and alcohol counselor would provide the counseling services. Again, it can be individualized. You could be providing family. You can be providing groups. So this is also the program where we have our intensive outpatient program as well, which meets 3 times a week for 3 hours at a time. So providing group for 3 hours, making sure that you're talking for 3 hours or you're meeting with the group for 3 hours. So making sure, how can we keep this entertaining so that people aren't falling asleep and that people are getting something, that the clients are really getting something out of the group. So those are some of the items that you can do with working with a bachelor's degree. Actually, you can get really good experience working with drug and alcohol. Is definitely different than working in mental health. It's interesting kind of the way that you need to provide treatment. So drug and alcohol isn't necessarily for everybody that likes mental health. Some people definitely prefer drug and alcohol clients over mental health clients. So this might be, one of those times where you need to kind of try out what's the right fit for you. Family-based mental health worker. So we talked about the family-based mental health professional earlier, where there's a team of 2 that are going into the home. So there's the master's level, and then there's the bachelor's level of individual. And so the bachelor's level, again, is providing therapy along with that master's level individual, going into the home, working with the children on their behavioral modifications, and working with the family on how the family can also help with that behavior as well. The team of 2 are actually on call for the caseload that they have. So they have a caseload of 8 families that's on their caseload. So it's a lighter caseload than what you might have heard earlier when I said about outpatient therapy. They'll have a caseload of 80 individuals. So you have a caseload of 8 families, and you're on call for those 8 families. So usually the master's level and the bachelor's level will alternate each week of who's on call. Being on call doesn't mean I'm running to their home. Being on call is I'm going to help guide you through how you're going to work through this issue that you're having with your child, because we worked on these, and we're giving you the tools as we're meeting with you. And that's why I'm on call for the 8 families that I'm specifically working with, because I know them. I know what we've been working on. So it's easier for me then to provide kind of those tools and reinforce those tools that we've been working on. We also have the community and school-based behavioral health technician position as well. So again, this was one of the bachelor's level positions that's working with a master's level, but the setting is in the school, working with ages usually between kindergarten through 6th grade, depending on the school district that you're in. So those are the age groups that you're working with them, behavior modification within the school setting. So if a teacher is struggling with one of the kiddos as part of the program, you might be called into the classroom to help address what the issue is, kind of live and in person, to really help that child overcome some of the issues that they're struggling with in the moment. Usually it's the master's level that's going into the homes. So it's usually the bachelor's level that's primarily working with the kids in the school setting themselves. And then in the summertime, again, kind of doing other types of programs with them in the summer. So it is a 12-month position. Then we have the mental health worker for child and adolescent partial hospitalization program. So this is the program. This is actually a 10-month position. Sometimes we might run the partial program over the summer, but it usually wouldn't be in the school. So usually this is just the 10-month kind of during the school days is when the program's being taken place. And you as the bachelor's level individual is working with the master's level clinician to help provide the type of treatment in that partial setting. So you could have a classroom of 12 students, all with different behavior needs. So you're really working with them together to help them address their behavior needs so that they can get back into the regular classroom. But you're with them all day. They're getting their teaching needs met there. So you're providing group, you're overseeing when they're meeting with the teacher. So again, helping them to get the skills that they need to be able to get back into the classroom, their normal classroom setting. We also have some entry-level opportunities. So even when you're going to school to get your bachelor's or getting your master's degree, there's also entry-level positions within the human services field that are kind of nice to help people get the experience that they need. So the two positions that I wanted to highlight was the certified peer support specialist and the psychiatric rehabilitation specialist. So the certified peer support specialist, I had talked early on about the certified peer support program that we have, where you're working one-on-one with a consumer. So somebody that's goal setting, like we're working on those 5 domains of wellness and health. And so trying to provide them supports, meeting with them one-on-one. What are we going to work on today? And then we have the psychiatric rehabilitation specialist that's working in the day program that we have. That's those that are working, again, it's 5 domains, but it's in a group setting. So the need might be a little bit higher for the client that's there, and really helping them with their life skills. That's where we also have the wellness cafe on site as well, so that they can gain some life skills so that they can eventually be out on their own. So providing them with the support and working with them. You can actually get a certification to be a psychiatric rehabilitation specialist, as well as a certified peer specialist. At Northern Tier Counseling, we provide the training that's needed to be able to get those certificates. So again, just really good, kind of nice stepping stones. If you're looking to get your bachelor's degree or working towards that, these are really nice stepping stone positions to be able to help figure out if this is the right direction that you want to go into or the right field. So just wanted to thank you for your time. My contact information, again, Missy Forey, I'm the Human Resource Director at Northern Tier Counseling. And again, feel free to reach out if you have any questions. Thank you for your time.